The U.S. just hit another milestone nearly 8 months after the coronavirus pandemic started in the U.S. So, how did we get here? At the start of 2020, it seemed that the coronavirus might not have a big impact on American soil, but come January 21st, it did.
Tonight, the CDC is confirming the first case in the U.S. of a new and deadly coronavirus.
This is certainly not a moment for panic or high anxiety. It is a moment for vigilance.
Soon after, cases start popping up across the country.
The CDC has just confirmed a few minutes ago the second case.
A third case now of the coronavirus has been confirmed here in the United States.
Then there's this announcement on January 31st.
I have today declared that the coronavirus presents a public health emergency in the United States.
On February 29th, a man in Washington state becomes the first person to die from coronavirus in the country. However, we'd later find out that 2 patients in California died of the virus earlier that month. And by this point, President Trump starts downplaying the virus.
The risk to the American people remains very low. It's going to disappear. One day, it's like a miracle. It will disappear. It will go away. Just stay calm. It will go away.
Although we recently learned Trump knew about the risks.
You just breathe the air. That's how it's passed. And so that's a very tricky one. That's a very delicate one. It's also more deadly than your strenuous flus.
But by March 11th, things get worse.
COVID-19 can be characterized as a pandemic.
And on March 13th,
today I am officially declaring a national emergency. 2 very big words.
Soon after, several states announced stay-at-home orders.
Stay at home.
Stay home, stay safe.
Quite simply, stay at home.
And New York becomes the global epicenter of the outbreak.
In New York, you are looking at a problem that is of a totally different magnitude and dimension.
By the end of March, the death toll starts increasing, and Trump changes his tone.
As we're saying to 100,000, it's a horrible number. Maybe even less, but to 100,000. So we have between 100 and 200,000. We all together have done a very good job.
In mid-April, COVID-19 deaths reached their peak, with more than 2,000 Americans dying a day. Meanwhile, the unemployment rate skyrockets to almost 15%, and protests against stay-at-home orders crop up across the country. As we enter May, various governors ease up on coronavirus restrictions, and although it started to look like things might be getting better, summer started and many ignored safety guidelines.
We're asking continuously for you all to be outside, to enjoy your Memorial Day weekend.
A few days later, the U.S. reaches this new chapter.
We have now lost over 100,000 Americans.
Throughout June, protests against police brutality take the nation by storm. And over the next few weeks, COVID-19 cases climb once again. But while these huge crowds left little room for social distancing, studies found the protests did not lead to a spike in infections. Though indoor events are another story. For example, Oklahoma health officials say Trump's rally in Tulsa led to a statewide surge in cases.
You are so lucky I'm president. That's all I can.
As the summer continues, hotspots emerge in states like Texas, Florida, Arizona. New daily cases soon rise to more than 70,000 a day, exceeding those in April, though that's partially due to an increase in testing.
When you compare us to other countries, I don't think you can say we're doing great.
And in August, schools and colleges begin welcoming back students, but some go virtual within weeks of reopening.
I think they're rushing it. I really do. I think they're rushing it. I think we should just step back, breathe, take a time out, rethink this thing.
Heading into the fall, the U.S. sees a slow decline in cases and deaths, but new daily deaths in the U.S. continue to hover at an average of around 1,000 a day. And while several vaccine trials continue to move forward, health officials warn we're still far off from things getting back to normal.
If you're asking me when is it going to be generally available to the American public so we can begin to take advantage of vaccine to get back to our regular life, I think we're probably looking at late second quarter, third quarter, 2021.
And with restrictions continuing to ease and flu season approaching, the concern of another wave in the United States still looms large.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.